Closure of gastrostomy, surgical. The physician closes a gastrostomy no longer needed. The physician enters through previous gastrostomy. The stomach is dissected free of the abdominal wall. The stomach gastrostomy site is closed with sutures. The abdominal incision is closed with layered sutures. Closure of cystostomy. The physician closes an artificial opening into the bladder, cystostomy. To access the cystostomy, the physician uses the original incision creating the cystostomy or makes an incision in the skin of the lower abdomen. After removing the sutures securing the cystostomy tube to the skin and bladder, the physician removes the cystostomy tube and sutures the bladder musculature to repair the opening. The physician places a drain tube, bringing it out through a separate stab incision in the skin, and performs a layered closure of the abdominal cystostomy incision. Closure of median sternotomy separation with or without debridement. The physician performs surgery on the sternum bone to put the bone back together following previous surgical separation. With the patient under anesthesia, the physician makes an incision overlying the sternum. The incision is carried deep to the bone and the separated pieces are identified. The physician may debride soft tissue or bone. The bony fragments are manipulated back together and held in place. The physician uses wire or other internal fixation devices to maintain the bone in appropriate position. The wound is irrigated and closed in layers. Closure of aortical left ventricular tunnel. The physician closes a previously formed aortic left ventricular tunnel. The physician performs a midline sternotomy, incising the skin, fascia, muscles, and sternum. The pericardium is incised and lines are placed for cardiopulmonary bypass. When bypass is established, the tunnel is isolated and ligated. The cardiac incision is closed. The pericardium is repaired loosely, leaving gaps for blood and fluid to drain into the pleural space. The sternum is reanastomosed with sternal wires and the skin is sutured in layers.